Okay, so now we're going to begin assessing Ethan's ears. So just by looking at him, I can tell his ears are of equal size bilaterally with no swelling or thickening. If edema were present, infection and trauma could be two indicators. His skin color is consistent with his facial color. His skin is intact with no lumps or lesions, and the Darwin's tubercle is not present. So now I'm going to move his pinna and push on the tragus. Okay, good. They were firm and Ethan did not report any pain or tenderness. If pain were present, this could indicate otitis external or a furuncle. So now I'm going to assess his external auditory meatus. I'm going to pull his pinna up and back since he's an adult. If he were a child, I would pull the pinna down and back. There's no redness, no swelling, or any discharge. In his external canal, there was no redness, swelling, lesions, foreign bodies, or discharge. If there was redness or swelling, it could indicate otitis externa. Purulent otorrhea suggests otis externa, otitis media if the drum has ruptured. Frank blood or clear watery drainage after trauma suggests basal skull fracture and is an emergency. So now I'm going to assess his tympanic membrane. Crystal clear. So Ethan's tympanic membrane is shiny, translucent, and pearl gray in color. The cone-shaped light reflex is prominent in the anterior inferior quadrant. It is flat and in the center, all which are within normal limits. So now I'm going to ask Ethan if he has any difficulty in hearing right now.
No.
Okay, since he said no, we're going to perform the whispered voice test. I'm going to place my finger on his tragus and slowly whisper a set of 3 random numbers and letters, and he's going to repeat to me what he hears.
C, 6 maybe.
Okay, let's try it one more time.
FB6.
Yeah. Okay, now we're going to do the other ear.
4K2.
Good. His hearing is intact. Okay, now we're going to be looking at the nose. So his nose is symmetric, midline, and in proportion. Now I'm going to check the patency of each nair. So what I'm going to do is place my finger over each nair to obstruct it and ask Ethan to sniff. Okay, good. There was a sniff present, which is good. If the sniff had been absent, we could suspect an obstruction. So now I'm going to look at his nasal mucosa and change tips here. You can't tilt your head up. Okay, good. So his nasal mucosa was pink in color, smooth, moist, with no signs of swelling, discharge, bleeding, or foreign bodies. The nasal septum was without deviation, and the turbinates are red in color with no signs of polyps. So now I'm going to assess the sinus areas. Okay, Ethan, tell me if any of these areas are tender. this?
No.
Okay, good. So now I'm going to assess his mouth, beginning with the lips, which are pink, moist, without cracks and lesions. Now I'm going to move on to the teeth. Okay. Open your mouth then. Good. All right, his teeth were were white, evenly spaced, straight, clean, and free of debris or decay. His gums were pink with a dotted surface. The gum margins at the teeth are tight and well defined. There's no swelling, retraction of gingival margins, not spongy, bleeding, or discolored gums. So now I'm going to look at your tongue. Stick your tongue out for me, all the way out. Okay, his tongue is pink and even. There's no white patches, nodules, ulcerations, or lesions. Lesions can be an indicator of oral cancer. Okay, now I'm going to look at his buccal mucosa. Good. It's pink, smooth, and moist. So I'm going to look at his palate. The anterior palate is white with irregular, transverse, rugged rugae. His posterior soft palate will be pinker, smooth, and upwardly movable. Okay, second tongue out. Okay, good. That was all within normal limits. Now I'm going to look in your mouth one more time and I want you to say ah. Okay, good. His uvula rises and his soft palate rises to the midline 2, which determines the function of cranial nerve 10, which is the vagus nerve. X5, cranial 5 is the vagus nerve. So Ethan had his tonsils removed, so I'll tell you what normal tonsils should look like. They'll be pink and peppered without indentations. There should be no exudate present, and they're normally at a size +1 or +2. No halitosis was noted, and there shouldn't be. So now we're going to do the breast exam. Take your shirt off for me. Okay, so his breasts are symmetric. The skin is smooth and even in color. There's no redness, dimpling, or bulging. His nipples are symmetric and placed evenly. His nipples are flat. So now I'm just going to palpate. Good, that was all normal. Okay, Ethan, raise your arms up for me. Up. There you go, good. So his breast tissue moved up, which is good. Now I'm going to inspect his axilla and see if there's tenderness or lymph nodes that can be felt. Okay, just move your arm like that. Okay, good. Alright, perfect. And I don't feel any nodes. So that wraps up my examination. Thank you for watching.